Hello, I'm Joe Serra with STI. This webinar is about why you need STI's clinical EMR for MIPS. The webinar will last about 25 to 30 minutes. We're going to go over a little bit of a MIPS overview. Certainly not going to get into detail, although if you want more detail, we have a webinar called Introduction to MIPS that will give you a lot more detail about the MIPS program. This is more of an executive overview talking about why you should pay attention, why you need our EMR for MIPS, and what you need to do now to prepare for MIPS. MIPS was actually set forth through a law passed last year by Congress, and the purpose of MIPS was to repeal the sustainable growth rate formula, which a lot of docs complained about, because it seemed to reduce their Medicare reimbursement and required an act of Congress to overturn that automatic deduction. It replaces that formula with a new payment formula that looks at value over volume, which means they're looking at cost and results as compared to procedure volume. It also streamlines multiple programs under the new merit-based incentive program. In the old days, you were required to do PQRS, meaningful use, and value-based modifiers every year. The MIPS program is going to take those three programs and turn it into one new program to determine a reimbursement for physicians. There's four categories that make up MIPS, what they call quality, resource use, practice improvement, and advanced care information. And they bring together a composite score that's weighted based upon what particular elements exist within each of those programs. Pay attention to the second program, advancing care information, which is 25%. The reason being that is involving a computer. And if you don't have a computer in meaningful use for an EMR, you will not get those 25 points. And I think it's going to be pretty hard to have a good grade in MIPS if you don't have a computer. So that's the purpose of today's webinar. MIPS really applies to just about everybody, all docs, DOs, chiropractors, dentists, podiatrists. The only people that aren't really involved in MIPS are going to be first-year Medicare docs and very small practices, seeing, I believe, less than 100 patients a year. So really, MIPS is going to affect just about everyone within medicine. And it starts in 2017, so we have to get ready for that. It's coming on us pretty quickly. This graphic you're going to see quite a bit today. This is a graphic that's going to show you how MIPS affects your reimbursement. And these percentages are on top of your Medicare reimbursement so that it can provide you in the first year either a 4% what they call payment adjustment positively or a minus 4% payment adjustment, which to me is sort of Orwellian. They're talking about positive and negative and neutral payment adjustments. In my world, they call that incentives or deductions, but the government calls them payment adjustments. We're going to look at this a little bit. This is what each doc has called their QRUR report, which is a report done by Medicare showing how you compare to other physicians. I think it's important that we look at this because I think it's going to give us a little insight to how MIPS is going to work. If we zoom in on this section here, you're seeing a 9-cell scattergram. And it's going to show you in that scattergram where you personally compared to other physicians in the area. So the 9 cells are about cost on one axis and quality on the other. So you have a low cost, average cost, and a high cost doc as well as a low quality, average quality, and high quality physician as well. So obviously what they're looking for is a high quality, right, low cost physician. This cell is, in their minds, the cell that gets the maximum incentive with the value-based modifier, and then the cell with low quality, high cost gets the maximum deduction. So this is the way the value-added modifiers work today, and I kind of think it's going to work similarly for the MIPS program. So if we take a look at the value-added modifier programs, which happen to be 4% in 2016, which is exactly where we are in 17 with MIPS, what you can see is that based upon where you fall within that matrix, you're going to either get a neutral, payment adjustment, 0, a positive payment adjustment, or a negative payment adjustment. So I really believe that as we get into MIPS, you're going to see a similar program with MIPS. So back to our little graphic here. Something that should concern you is that Medicare's goal for MIPS is to get all the insurance companies to participate within this program, which means if you don't do a lot of Medicare, which in the past has people feeling they didn't need to worry about things, if this is the case and they get all the insurance companies to participate, then being a small Medicare provider won't save you. You're going to get hit by the other insurance companies. And we know currently that several insurance companies are already signed up for the MIPS program, and they're going to follow the Medicare MIPS rules and lower or raise adjustments for docs based upon it. We feel that eventually all the major insurance companies will join the program. Why wouldn't they? It's a great way to adjust income for docs. The other thing people are concerned about is whether or not MIPS will get changed with the new administration. We don't think so. Reason being, MIPS is a budget neutral program, which means that they're going to take reimbursement away from low quality, high cost stocks to give that money to high quality, low cost stocks. So if it's not going to cost the insurance industry any money, why wouldn't they do it? What they're doing is giving, in my mind, an incentive to practices to do what they want you to do. And it's not costing them anything. So I got a feeling that it's not going to change with the new administration. Also, the program has a 2-year lag period, which is typical for most of these programs, which means the 2017 program that starts in January won't really affect your reimbursement until 2019. And that, to me, means a lot of doctors won't even notice it for 2 years. And there's actually a survey done by Medical Economics that says exactly that less than half of the docs are paying attention to this program or even know about it. So it's going to happen by the time you find out in 2019 that you're going to get a negative payment adjustment. You've already missed 2017 and 2018. So you're going to get a negative adjustment in the following year as well. So in the beginning, I think a lot of docs are going to get surprised that their reimbursement's being reduced because they're not paying attention to the program. I find this graphic to be most interesting. This is from the American College of Physicians, and they're showing that small practices and solo 2 to 9 or even below 24 docs in a practice are going to get penalized more by MIPS than larger practices. And the reason basically is they don't have a staff that can pay attention to stuff like this. So the smaller practices are more susceptible to the deduction. And that concerns STI because we have a lot of small practices using our software. As a matter of fact, we're concerned about practices staying independent, and meeting the MIPS requirements is going to be required if you want to stay independent. So we really want to help our practices to do well with MIPS. And we believe that they're going to need our assistance, especially the small practices, just because they don't have the staff available to do the MIPS program. All right. So if 25% of your MIPS score is based upon meaningful use information, which means the EMR, to maximize that score, it means you have to have an EMR. And I know a lot of our practices aren't using an EMR, or using an STI EMR, or using the light EMR. So this is our concern and why we're having this webinar today, to explain that we need to get you on our EMR quickly. All right? MIPS is all about your patient data. And that means, you know, how you use your EMR on a day-to-day basis affects that data. One of the things MIPS is concerned about is interoperability and exchanging information with other physicians, other medical laboratories, medical centers, etc. To do this, you need to have a certified EMR like the STI clinical EMR. So STI clinical provides you with multiple products. It allows you to e-prescribe. It allows you to interface with laboratories. It allows you to work with medical centers and to do direct messaging with other practices. It also provides a patient portal so that you can communicate with your patients. And of course, it provides medical specialty templates so that you can provide chart notes based upon your specialty. So all of that's included in the ChartMaker EMR. So if MIPS is all about your patient data, that means a couple of things. One is that you have to have the EMR up and running by January 1st of 2017 to participate. It also means that we have to pull data from your EMR to help you report for the MIPS program. So if you are using an EMR besides clinical, we really can't help you. You're going to have to go to your EMR vendor and find out what they're doing for MIPS. And we can only help you and pull data if it's our EMR, because we know our EMR better and we don't know how other EMRs work. Also, if you have the ChartMaker Lite EMR, you need to upgrade to the full clinical EMR prior to 12/31/2016 if you want to participate in the MIPS program. All right. So if you don't currently have clinical, you know, at the end of the webinar, we're going to provide you a way of getting information and requesting a quote. So I want to encourage you to follow that advice, send in a request for a quote, and talk to an STI rep about the MIPS program. All right. Besides working with our EMR, if you need more help, we also have an optional program. I want to make sure you understand it is optional to help you with MIPS if you feel like you can't do it on your own. Many practices probably can do MIPS, the bigger ones that have a good staff. But if you don't feel like you have the ability to do that, we have a program available for a monthly charge in which STI will provide you with a coach who will work with your office staff and monthly webinars to educate your people on how to do MIPS. So that program is available as well if you have the clinical EMR. But obviously, whether you do it yourself or whether you use STI's help, the first step is make sure you've got an EMR to handle MIPS. Just for your information, this is the MIPS Assistance Program, and it shows you what is available from that program. We're going to have a kickoff meeting. We're going to have on-site meetings to go through things like your quality measures and selecting your quality measures, reviewing your performance reports, implementing clinical practice improvements, and the final meeting will be your MIPS attestation. So that program is available from STI. All right. If you want to do the STI MIPS Assistance Program, you're going to have the clinical EMR installed by January 1st. You have to make sure you're enrolled in the STI Health Portal program and the patient portal. You have to not opt out on data collection, and you have to access your QRUR performance reports. Your trainer, who is the person that's going to work with you, will help you pull that information, but you need to do it yourself because it's personal information, so the coach can't really pull it for you. You've got to do it with him. And then you need to assign someone within your practice who will work with the coach to be the coordinator for the practice. So let's talk a little bit about why you should do this, all right? On the graphic that we were showing you currently, there's a thing called a scaling factor. This is kind of interesting. The scaling factor is sort of a fudge factor based upon how many practices succeed versus how many practices fail on the MIPS program. It's kind of interesting. If you do the math, the current scaling factor is 3x, which means in year one, you can get up to 12%, 4 times 3, 12% of an incentive or positive, increase in your reimbursement versus a -4, which says to me that they expect 3 people to take a penalty for every doc that gets the maximum bonus. So it seems to me they're planning for a lot more physicians to get deducted than get a positive adjustment. So we feel that the early adopters of this program, right, have the best chance to get a reimbursement increase. And I'll tell you a personal story. When I was a young man in high school, there was a new program for college scholarship called the PHEAA program. Our guidance counselor told everybody to apply because she felt that the program was so new and people didn't know about it, there was a good chance that we would get a grant, which we did. And I think that's a pretty good analogy to this program. If most docs don't know about it, you probably have a better chance of getting an incentive, probably an increased incentive in the early years if you're one of the first people in this program. All right, so here's the bottom line. If you do nothing and just let MIPS hit you, you're looking at a 4 to 9% reduction on your insurance over the next 4 years, right, and onward, right? So that's pretty much guaranteed. If you're not doing MIPS, you're going to get a negative adjustment. If you do participate within the program with that 3x scaling factor, you can get as much as a 27% increase in your reimbursement based upon the year of the program. So your range is a -9 to a positive 27 based upon how you do, how well you do, and how many docs are participating and what the scaling factor is. So it's a pretty big range on your reimbursement. We did some calculation, and I practiced doing like $500,000 in revenue. You're looking at, a pretty big hit. From one standpoint, over $100,000 over 4 years negatively versus $300,000 positively based upon where you fit. So it's a pretty big deal for most practices. The MIPS assistance program does have a cost if you want to get involved in it. It's $250 per month per practice for the first provider and $125 per month for each additional provider in the same practice for a period of 15 months. So that's the cost of the program. We designed the program to cost about 1% of a typical provider's gross receipts, and we're trying to keep it that way. So we sort of feel that if we reduce it by 1%, it'll be affordable, and we're going to spread the cost over a 15-month period so that you can pay it over time. So we felt that for a 1% cost, you could potentially increase your reimbursement from between 3 and 26% if you do well in the MIPS program and if you qualify for some of the scaling factor numbers. That's a pretty good investment opportunity in my mind. The lawyers make me say this, that we can't guarantee you're going to not get penalized or that you're going to get an incentive. That's really up to you. But I think it's a pretty good bet. All right, so what do you need to do now? First thing you have to do is make sure you have ChartMaker Clinical EMR. And if you don't, you need to get the clinical EMR and schedule EMR training before the end of the year. You need to attend the monthly MIPS webinars on STI'S website. They're free. So go ahead and sign up for those and pay attention to the MIPS program. And finally, you need to decide whether you want STI to help you with MIPS. Again, that's an optional program. We wanted people to sign up by October 1st, but obviously we're past that date now. And you can still sign up for it, but we're already starting with some practices to begin preparing for MIPS. All right. Again, if you don't currently use an EMR or use the ChartMaker Clinical EMR, you need to contact us. And we're going to send everybody, and it's available on our website, information about the MIPS program, and you can pull this information down from STI, or go to this area here where you can sign up for it. So if you go on to the STI website, you can go ahead and sign up for the MIPS program. One last thing I want to point out, STI has a program called Revenue Cycle Management, which is relatively new to us. If you're using the Revenue Cycle Management program from STI or from an STI billing service partner, you're going to get a 25% discount on the MIPS program, all right? So a lot of practices don't know about Revenue Cycle Management, but it's pretty nice. It allows us to help you to not only work with MIPS, but also lets us to help with your collections and make sure you're collecting the maximum amount of your money. You can also get information about that from STI's website as well. So if you need to get a hold of me, you can do that jcira@sticomputer.com or go to our website, look up MIPS, and sign up for the program. All right, well, thank you for attending. I appreciate your time, and I hope you, if you haven't implemented an EMR, you take this opportunity to do it before the end of the year. Thanks, everybody.